16th century and was called peritonitis, which means inflammation of the peritoneum surrounding the cecum and vermiform appendix. The appendix is a small tube-like structure attached to the first part of the large intestine, also called the colon. The appendix is located in the lower right portion of the abdomen. It has no known function, and removal of the appendix appears to cause no change in digestive function. What causes appendicitis? The cause of appendicitis relates to blockage of the inside of the appendix known as the lumen. Also, bacterial or viral infection in the digestive tract can lead to swelling of lymph nodes, which squeeze the appendix and causes obstruction. Genetics may also be a factor in others. For example, appendicitis that runs in families may result from a genetic variant that predisposes a person to obstruction of the appendiceal lumen. What are the symptoms of appendicitis? Pain in the abdomen, first around the belly button, then moving to the lower right area. There is also loss of appetite, nausea and vomiting, constipation or diarrhea, inability to pass gas, low fever that begins after other symptoms, and abdominal swelling. But not everyone with appendicitis has all the symptoms. The pain intensifies and worsens when moving, taking deep breaths, coughing, or sneezing. The area becomes very tender. People may have a sensation called downward urge, also known as tenesmus, which is the feeling that a bowel movement will relieve their discomfort. How is appendicitis diagnosed? Through medical history and physical examination. Before beginning a physical examination, a nurse or doctor will usually measure vital signs, temperature, pulse rate, breathing rate, and blood pressure. Usually, the physical examination proceeds from head to toe. Examination of the abdomen helps narrow the diagnosis. Location of the pain and tenderness is important. Pain is a symptom described by a patient, and tenderness is the response to being touched. There are two signs called peritoneal signs, rebound tenderness and guarding, suggest that the lining of the abdomen is inflamed and surgery may be needed. Rebound tenderness is when the doctor presses on a part of the abdomen and the patient feels more tenderness when the pressure is released than when it's applied. Guarding refers to the tensing of muscles in response to touch. The doctor may also move the patient's legs to test for pain on flexion of the hip, called psoas sign. Pain on internal rotation of the hip, called the obturator sign, or pain on the right side when pressing on the left, which is the Robsing sign. These are valuable indicators of inflammation, but not all patients have them. Laboratory tests. Blood tests are used to check for signs of infection, such as high white blood cell count. Blood chemistries may also show dehydration or fluid and electrolyte disorders. Urinalysis is used to rule out a urinary tract infection. Doctors may also order a pregnancy test for women of childbearing age. Imaging tests, X-rays, ultrasound, and computed tomography can produce images of the abdomen. Plain X-ray can show signs of obstruction, perforation, foreign bodies, and in rare cases, an appendicolite, which is hardened stool in the appendix. Ultrasound may show appendiceal inflammation and can diagnose gallbladder disease and pregnancy. By far, the most common test used, however, is the CT scan. What are the complications of appendicitis? The most serious complication of appendicitis is rupture. The appendix bursts or tears if appendicitis is not diagnosed quickly and goes untreated. Infants, young children, and older adults are at highest risk. A ruptured appendix can lead to peritonitis and abscess. Peritonitis is a dangerous infection that happens when bacteria and other contents of the torn appendix leak into the abdomen. In people with appendicitis, an abscess usually takes the form of a swollen mass filled with fluid and bacteria. In a few patients, complications of appendicitis can lead to organ failure and even death. What is the treatment for appendicitis? Surgery acute appendicitis is treated by surgery to remove the appendix. In some patients, laparoscopy is preferable. What is laparoscopic appendectomy? It's a minimally invasive procedure. Surgical technique involves making several tiny cuts in the abdomen and inserting a miniature camera and surgical instruments. As many as 3 or 4 incisions are made. The surgeon then removes the appendix with the instruments, so there is usually no need to make a large incision in the abdomen. The camera projects a magnified image of the area onto a television monitor, which helps guide the surgeons as they remove the appendix. As you can see here, the attached photos on the laparoscopic procedure. And
Okay.
And that's our topic for today. Attached also is a video about the procedure of laparoscopic, just to give you an overview on how it's being done. It is attached in the PowerPoint presentation also. Thank you, and thank you to all.
Thank you very much, Carlo and Manny.
Yes, sir. You're welcome.